Okay, good morning everybody. I'm here to provide the COVID update for the Murrumbidgee region after our long weekend, and I hope everybody had at least some time off and perhaps a bit of an opportunity to watch some footy on the telly. Over the long weekend across our region we had a pretty good weekend, all things considered, with 4 new cases reported. And as you probably saw over the weekend, 2 of these new cases were in the Edward River LGA and were actually close contacts of a case that we had previously reported. And that brings the number of cases in the Edward LGA to 3. There was another case in the Hilltops region, but again that was a household contact of a known case, and that person's been in isolation the entire time. We also saw one in there, Albury LGA, but please don't be concerned because that person has a residential address in that region, but is actually not in the Albury area. One new case for today with a residential address in the Federation LGA, so a new area. However, this person was not tested in New South Wales in our region, and we are investigating that case, and we'll certainly provide more details once contact has been made. So that brings the total number in our region to 38 cases during this particular part of the outbreak. So that's 1 in Federation, 3 in Edward River, 1 in Griffith, 25 in Hilltops and 8 in the Albury LGA. So in terms of our hospital and the impact of those COVID patients across our region, majority of them continue to be cared for in the hospital, in the home, and we've got 29 that are currently being cared for, again by a medical team, a multidisciplinary team with nurses and others, mental health and social supports. We have in Wagga Base Hospital, we have 3 patients, with 1 in the intensive care unit but not ventilated, and also we have 2 in the COVID ward. There's also a patient who is very unwell with significant underlying conditions that was transferred to an intensive care unit in Melbourne. We have 2 recovered cases, although noting that we actually don't report recovered cases anymore. So in terms of community transmission, I guess the main area that we're focusing on, that it is a concern, is in that Deniliquin and Moama region. And over the weekend we did publicise a number of venues and exposure sites from there. We've had quite a few questions about venues, and the advice is different according to whether people are close or casual contacts. It's very variable, and it depends on where people were standing in the venue, how long they were there for, whether they were wearing masks, and soon to be in public health, whether they were vaccinated. So we ask people to please just follow the advice that the public health unit provides to you, and it may be different according to different venues. So the next few days are going to be really critical for managing the outbreak across our region. It is encouraging that we haven't seen further outbreaks here in Wagga, but we know with the vaccination rates in that Edward River LGA being low that we really do have a risk there, and we really do need to increase those vaccination rates. So the data in Edward River has been confirmed. First doses is sitting only at 60%. We really need to have a campaign to get people to come forward in that LGA and get vaccinated as quickly as they can. Fortunately, there's a new practice that's now vaccinating as well, so that makes access through GPs really good. A couple of pharmacies in the region, and of course our state-run vaccination clinic there. So please, people in that Edward River LGA, we really are asking you to come forward and let's get those vaccination rates up much higher. So in terms of congratulations, the Murray River LGA have absolutely blitzed it in our region, right out of the ballpark. So they're sitting at over 95% of people in that LGA have come forward and had their first vaccination, and 80% already fully vaccinated. There's quite a lot of LGAs in our region who are also sitting at 94% first doses, which is really great. We've got Hilltops and Cootamundra, Gundagai, a whole range of LGAs who are doing really well. So from a state perspective, our focus is very much on vulnerable population groups and really going out and vaccinating people who may not have access or particularly Medicare cards. So we have No Card, No Worries campaign, and if you don't have a Medicare card, you can still get vaccinated with us. We do not require that card to give you your jab. And we're really focusing now. We've been to Juni yesterday, had a great response there with about 80 vaccinations given. And again, the pharmacy and the GP have had increased supplies. Really, in terms of the results for vaccination in the LGAs, it has been really dependent on two things. One, as to whether or not there's been a scare or an outbreak in that region, but also really around the supply of vaccine, because GPs and pharmacies with good supply of vaccine can really get those numbers up pretty high. So we're now seeing across our region great improvements in the supply of vaccine coming forward. And of course, Moderna is now available in pharmacies, which is terrific. And there are 100 venues across our region where people can come forward and get the jab. So what I want to say to people today is we're starting to hear about the roadmap. We're starting to hear about easing of restrictions. And for particularly our colleagues who are in Sydney, in the Greater Sydney region, where they've been in lockdown now for over 100 days, it is welcome news. But for us here in the regions, we have a risk with some of the loosening of restrictions, and our only way of managing it and keeping ourselves safe is to increase our vaccination rates and to continue to come forward for testing. We saw only about 10,000 tests from all of the providers across our region in the last 7 days, which is quite a reduction on the week before. So please, even the mildest of symptoms, we really need you to come forward. Our safety plan is testing and early isolation, and that then reduces the transmission in the community, and then that then will help keep us safe and reduce the impact on the health system. We do expect, with the opening up at 70% state vaccination rate and then 80%, and by the time we get to December, this period now, in the next few months, will be the greatest impact on our health system. We will see more cases and we will need to provide more care to more people. So please, you can help, come forward, get vaccinated, get tested, and our public health service will continue on to keep us safe. So that's it. I'm happy to take questions. Thank you.
Just picking up on the Deniliquin situation, or the Edward River, I should say. I know there was one person who had tested positive, and then there were the other two positive cases. Has it been confirmed? Are they household contacts, or I know there was some concern around whether they were staff members at the hospital who may have picked up the virus from the patient, or are they household contacts? Are you able to clarify?
Yeah, so they are close contacts of the known case. They are not staff members from the hospital. Yeah.
And with Edward River and the confirmation, I guess, around that vaccination data, is there any explanation from the health district's point of view as to why the vaccination rates are particularly lower in that LGA, when particularly in Murray, which is the very next LGA over, they've got such high rates? Is there any sort of reasoning, I guess, behind those discrepancies?
Yeah, and look, we're seeing only 45% of people in that Edward River LGA that have been fully vaccinated. And when the state's talking about a 70% fully vaccination rate, that's a concern. I do think it is duly attributable to the amount of supply that has been available in that region. And I'm really pleased now our colleagues in the Primary Health Network have confirmed that there is a much greater supply going through to that region now. And we've got a willing population, we've got a great group of GPs, a couple of pharmacies, and we'll continue. We have a clinic out there every 3 weeks, and we'll keep going back until we get those rates up. And I think now that people have had an outbreak in their community, I think we'll see those results in the next 6 weeks really climb significantly.
Has supply been flagged with the health district previously as to an issue, I guess, that vaccination providers were coming up against?
Well, the supply is a complex issue because, as you know, the Australian government manages the distribution of vaccines across our region. And look, there's no doubt about it that the lion's share of vaccination is being done by our doctors in GP practices. And it all depends on the amount that practices are requesting and then receiving. So it's outside of our jurisdiction to be able to influence. But what we can do is, where there are low vaccination rates, is to continue to go in and provide those clinics. But I think also for that region where we have got fruit pickers and other people, other workers, that we do really need to focus in on people who may not have a Medicare card, who may be afraid of coming forward. So we're really going to go with no card, no worries, and see if we can pick up some of those people who haven't come forward yet.
Just on that Federation case, do we have any more details on how they contracted the virus?
Look, I'm afraid I don't have any details at this point. We've just been notified of that positive result. And as I said, the testing was not done in our jurisdiction, so we're waiting for more information. We'll certainly let you know when we have further data.
And in terms of genomic testing, with the Hilltops one, have we got a result back on how that case originated from?
So still no results from that formal genome testing as yet. But as I said last week, reasonably confident that case was linked with another outbreak hotspot, but we're still awaiting. There's quite a queue with the genome testing in the pathology laboratories, and it does actually take some time to complete.
When do you reckon we'll have a result by?
I have no real guess, but we'll certainly let you know when we're here. Thank you.
Just in terms of opening up, do you feel the vaccination rates will be high enough when we do hit that 80% mark and people from all over the state will be travelling through?
So I guess the first thing is that people, when we get to the 70% roadmap opening up, it's only regional areas that can travel across other regions, and that's excluding the Greater Sydney LGAs. And it's not till we get to 80% that we'll have no distance restrictions, albeit that I think when we get to 80%, people will need to be vaccinated to be able to travel into the regions. Am I concerned? Yes, I'm concerned, but I also know that it's really important that we go through this gradual transition back to living with COVID. And we know that we will have a health system that will be able to manage people and cases as it comes forward. We've got lots of capacity within our hospital and our hospital in the home that we haven't utilised yet. So it's a matter of really working with our communities and making sure that we limit that exposure.
Is the health district seeing any noticeable increase in demand for the vaccine as we approach that October 11 deadline for increased freedoms?
Well, we're seeing a rapid increase in the number of people vaccinated. You know, we're over 80% now and 58% fully vaccinated, but we've really got a way to go to get to that 70%. We are similar to other regions, but because we now have a much better supply, the good news is also you can pretty much make an appointment and get in within a couple of days or even a day in some cases. So I think that makes it much easier for people now to be able to go and get vaccinated. There are lots of walk-in clinics now available for people, and the eligibility criteria are much easier to understand. So I think we're going to see a lot more people just come in and get it done. And of course, we're seeing a great response from parents bringing their children in, which will also help to lift our numbers.
The September 30 deadline has obviously been and gone now for health staff to be vaccinated, and I know you did touch on this at the end of last week with Sally on the breakfast program, but is there any update as far as how many positions have been affected by people either unwillingly or not able to access any vaccine yet?
So we had 97.3% of our staff vaccinated, and there's a small number of staff who have approved contraindications. Outside of that, there are a small number of staff who are still on long service leave and maternity leave. We're waiting to get confirmation of their vaccination. And the small number of staff who declined vaccination, we're currently working through those. They're no longer working with us. They've been placed on leave. And we've still got that small window of opportunity to get that number down even further. So the next week will be all telling.
When you say small number, are you able to give an exact figure?
I'm going to wait until we complete the week and we work through and give people that last chance.
Are you confident people will come around, or do you think these people
Look, there are some who are still uncertain. It sort of falls into two camps, those who have definitely declined and decided, and I respect that's their decision. We're only following the public health orders, so they won't be able to work in our local health district anymore. And there are some of those who are still really waiting to see and get more information about the safety of the vaccine. So it's with that group that we're still working with.
And have any local health facilities been affected by that small number of staff with the vaccination rule?
So the majority of people who have declined so far have been one or two from across our health facilities. We do have 47 health facilities, 33 hospitals in our region. There was only one hospital that was impacted by a clump of people, and that was in Deniliquin.
Do you think there's a correlation there between that and the vaccination rate data that we discussed earlier today?
It's really hard to say. I mean, obviously we respect their choice and we respect their decision. And, you know, I don't really think there's any great correlation. I think it's just a statistical anomaly that they're all in the one place.
And have you had to bring in locums or additional staff to assist with staffing at Deniliquin Hospital this week?
Yeah, well, there's no doubt that it has been challenging for Deniliquin Hospital. But the managers there and the people managers there have made an enormous effort in rostering to the available beds that they have open, which has been really fantastic. And again, because they had an exposure at that site and they've got a small number of staff who are in isolation, that just added to their issues. So I want to thank, we've got people from Wagga, Griffith, Corowa who have gone out to assist and help. And that's the best news. We are part of a network. So that hospital will never be alone. We will always be able to support and help them during their time of need, and so that's indeed what's happened.
And how long can, I guess, that arrangement continue?
Well, we'll continue to support Deniliquin, and we'll obviously go through, once we separate staff who decline, then we can go through a recruitment process. But at the moment, we're not able to advertise those positions because they still haven't vacated them. So that will happen soon, and I'm sure that we'll attract new staff. It's a beautiful venue there.
Also hearing some chatter that with the roadmap that the state government has announced, and I think it's December the 1st, vaccinated or unvaccinated, there's going to be freedoms afforded to everyone. And as a result of that, people are either deciding not to go ahead with second jabs or just not go ahead with vaccination at all, thinking they will wait until that 1st of December and then we'll have the same freedoms, I guess, that vaccinated people have. Have we heard of instances of that occurring in the Murrumbidgee Local Health District?
Well, fortunately, I haven't heard of instances of people not coming forward to have their second jab. And I think there's a really important caveat on the roadmap to ease restrictions, and that all depends on the response that occurs with the 70% and 80% opening. And if we get a dire situation, I'm sure that some of those restrictions that are proposed will be revised. But look, I think people in rural communities care for each other, they care for their community. And I think it's really important that people come forward now and particularly assist businesses who over the next few months will also be required through screening and QR code entrance to be able to check that people are vaccinated before they come into their facilities. So I just appeal to the rural community. That's what makes us strong. All right, thank you then, colleagues. Sure, how would you like it?
Just here would be good. Yeah.
You don't want it with the hospital.